Have you ever heard of pet therapy? Did you know what is pet therapy? Pet therapy is a guided interaction between a person and a trained animal. It also involves the animal's handler. The purpose of pet therapy is to help someone recover from a cope with a health problem or mental disorder. It actually has been around in some form or another for over 100 years. But it's no surprise that many of us never heard of it, or maybe only have a very little knowledge about the topic. Pet therapy was first popularized around 1860 thanks to the famous nurse Florence Nightingale. She noticed that patients with chronic illness felt better when they had an animal partner by their side. Pet therapy is a broad term that includes animal-assisted therapy (AAT) and other animal-assisted activities (AAA). AAT is a formal, structured set of sessions that helps people reach specific goals in their treatment. It is a growing field that uses dogs or other animals to help people recover from a better cope with health problems such as heart disease, cancer, and mental health disorders. Animal-assisted activities, on the other hand, have a more general purpose such as providing comfort and enjoyment for nursing home residents. AAA involves more casual meetings in which an animal and its handler interact with one or more people for comfort and recreation. Okay, so now, imagine you're in the hospital. Your doctor mentions the hospital's animal-assisted therapy program and asks if you'd be interested. You say yes, and your doctor arranges for someone to tell you about the program. Soon after that, an assistant dog and its handler visit your hospital room. They stay for 10 or 15 minutes. You're invited to pet the dog and ask the handler questions. After the visit, you realize you're smiling, and you feel a little less tired and a bit more optimistic. You can't wait to tell your family all about the charming canine. In fact, you're already looking forward to the dog's next visit. Pet therapy builds on the pre-existing human-animal bond. Interacting with a friendly pet can help many physical and mental issues. It can help reduce blood pressure and improve overall cardiovascular health. It can also release endorphins that produce a calming effect. This can help alleviate pain, reduce stress, and improve your overall psychological state. Pet therapy can be used in many different ways. The goals of a pet therapy program can include improving motor skills and joint movement, improving assisted or independent movement, increasing self-esteem, increasing verbal communication, developing social skills, increasing willingness to join in activities, improving interactions with others, and motivating willingness to exercise. Other benefits of pet therapy can include making you happier, lessening depression, and improving your outlook on life. Other than that, it can decreasing loneliness and isolation by giving you a companion. Pet therapy can also reducing boredom, reducing anxiety because of its calming effects, and helping children learn empathic and nurturing skills. In a study published in the Journal of Anxiety, Stress and Coping in 2003, 58 people without clinical diagnosis were presented with a stressful situation. They were told that they might be asked to hold a tarantula sitting elsewhere in the room. Those who considered this while petting an animal, whether it was a soft fluffy rabbit or a hard-shelled turtle, experienced a reduction in stress and anxiety. But those who were petting a plush toy version of those animals didn't display the same effects. Which makes sense if the relationship and interaction with the animal are the key. On the flip side though, other studies with dementia patients have shown that robot dogs are effective at reducing stress and anxiety. These robots look, sounded, and behave a lot like a real thing, and the patients responded to them a lot like they did with real animals. So, the benefits of the relationship were probably replicated, unlike with the plush toys in the other study. You might also wonder about the possible risks that may occur. Some of the biggest risks of pet therapy involve safety and sanitation. People who are allergic to animal dander may have reactions during pet therapy. Animals in pet therapy programs are typically screened for behavior and health. And animal's owner and handler must also undergo training and an evaluation to help ensure a positive experience. The first step in pet therapy is the selection of a suitable animal. Many groups and organizations train and connect volunteer owners and pet with healthcare providers. Before an animal and its handler can participate in pet therapy, the team has to fulfill certain requirements. As of now, the only center that offers the A18 program is Dr. Malaysia, which first started in 2007 with Furry Friends Farm founder Sabrina Yip and Jill Robinson, founder and CEO of Animals Asia Foundation. Since 2009, Dr. Salihin Ibrahim has been the primary coordinator of the program, with a team based in the Klang Valley and Penang. Dr. Salihin Ibrahim have been running the program since 2006, and since then, he had faced lots of challenges and obstacles being a Malay Muslim having dogs, including poisoning of some of his therapy dogs by the locals. Dr. Salihin and his team will bring the dogs to the visitation upon request, and they'll go to places such as orphanage or old folks home. Dr. Salihin will scout the location beforehand to make sure that it is suitable to bring the dogs. They are very selective and careful with the sensitivity and sentiments of the public at large with regards to the dogs being used as therapies. Dr. Malaysia has been featured a lot in the media such as TV, radio and newspapers. One of their videos has even won the Audience Choice Award, but it just stopped there. Dr. Salihin said that there is no promise for a bright future for animal-assisted therapy program in Malaysia, as it is difficult for this sort of therapy to be popular in this country, and as to why he said that is mainly because he hasn't found anyone suitable to take over his role yet. Since they are the only one doing this sort of therapy, if no one takes over, it would be difficult to continue. Some people are also quite worried of the alternative form of treatment, and they are not willing to be more open-minded to other forms of treatments that could help them. But maybe with more awareness, education, and understanding on pet therapy, we might see a turning point for the future of animal-assisted therapy program in our country. If you find this video interesting, do share and subscribe to spread awareness for people out there. Thank you!